listening to Under the Umbrella podcast. Each week, we'll discuss various topics under the umbrella of the LGBTQ community. And I'm your host, Angel. Hey everyone, welcome to another episode of Under the Umbrella podcast. I am your host, Angel, and today's guest will be Chanél Tinsley, and we will be talking about a healthy pregnancy journey. Chanél is a nurse practitioner currently working in women's health with over 14 years of experience, serving in varied specialties in healthcare. She is also the owner of CMT Enterprises, LLC. For anyone who's ever visited a hospital, you know how busy the staff can get caring for people from diverse backgrounds, ranging from various races, ethnicities, ages, religions, and sexual orientation, to name a few. On today's episode of Under the Umbrella, I will talk with Ms. Tinsley about having a healthy pregnancy journey. I'm really excited to do this episode. I know there's so much to talk about with a healthy pregnancy journey, and we'll touch on a few topics. But I just love Chanél. She is freaking awesome. I just love her. She's so knowledgeable, and I cannot wait to see her become a doctor and continue servicing, women in their journey to become a mom. So, let's get this party started. Hello, Chanél. Welcome to Under the Umbrella podcast. How are you?
I'm doing well, and yourself? How are you, Angel?
I'm good, thank you. So, I know I was experiencing some technical difficulties prior to us getting started. So, thank you so much, Chanél, for joining myself and my audience for this episode of Under the Umbrella, which we'll be talking about a healthy pregnancy journey. And I just first want to give you a shout out and thank you for your service. Chanél, those of you on YouTube, you can see her, but she is one of our essential workers. We're all essential, but the government.
We are all essential.
Right, we're all
yes.
essential. But she is a nurse practitioner, and I tell her all the time that I appreciate her service. So thank you so much, my beautiful goddess sister. Thank you.
Yes. Much appreciated.
Oh, no problem. You are very much appreciated. I do. I told you my story, how I've learned to appreciate nurses big time. So I'll get to my talking points. So the first question I wanted to ask you was to please speak about the importance of seeing a doctor during your pregnancy.
All right. So first and foremost, I want everybody to know you have options. So you don't always have to see a doctor per se. You can see a nurse practitioner like myself. You can see a midwife, a certified nurse midwife. So you don't have to be only seeing a doctor. And some women prefer seeing a midwife over a doctor just because they offer other options, non-medical, they're all medical interventions, but lower interventions than maybe a doctor would. So know that you have options. With that being said, it's very important to make sure that you are being followed by some type of provider, just to ensure that you're having a healthy pregnancy. There's a lot going on in our body when we're pregnant, and we need to make sure that our body is tolerating it well, that our baby is doing well. A lot of times medicine gets lost in how the baby's doing, that mommy got pushed into the background. So I am an advocate on making sure that mommy is doing well. And because if we don't have a mommy, we're not going to have a baby. So that for me, that's my personal mission, to make sure that my mom is doing well along with our fetus or our baby. But a lot of times women don't go to the doctor because we're womening. We're busy being a mom, we're busy being wifey, we busy being everybody else's everything, that we
Mm.
become low on our own totem pole.
Oh,
So a lot of times in pregnancy, we are playing catch up because you haven't been to the doctor since the last time you've been pregnant. For some
right.
women, for some
Right.
women.
Right.
So um, a lot of times we're catching things like blood pressure issues, we're catching things like diabetes issues, we're catching things
Mm.
um, that women just they were like, oh, that, oh, it was kind of been there for the last couple of years, and it just, I start living with it, I didn't know. So it's important that we are monitoring our mommy and our baby,
Right.
just because anything can go crazy in pregnancy.
Right. 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 Wow. Thank you.
No
Let's
problem.
see. Okay. My next question is labor and delivery. We hear the
Mhm.
beautiful stories of healthy, happy babies. What
Mhm.
can go wrong with labor and delivery, and how can those things be avoided prior to delivery?
That's a loaded question. So,
I know. I know.
the shorter answer is what can go right, which is a happy, healthy baby and mommy.
Right.
Anything can go crazy in labor and delivery. We can
Hmm.
have a wonderful labor process, and then as we're birthing, the whole World War II blows up on us. Or
Mm.
we can have a crappy labor and we have a beautiful delivery. Um, so that's why it's very important for a mom to be closely monitored during her labor progress. Depending on what's going on in her pregnancy is depending on how strict we have to be with monitoring mommy and baby during her labor.
Hmm.
Um, Various things that can happen. One of our biggest concerns is bleeding,
Oh.
hemorrhaging, postpartum hemorrhaging. Um, Not just, a lot of times women focus on the fact of, did I lose a lot of blood right then and there during that delivery? We also are looking at the whole postpartum stay. So that's why we're monitoring mommies in the hospital for a day or two to ensure that we don't have a latent bleed. So basically, you had an appropriate amount of bleeding during your labor process and your delivery process, but you start saturating more pads an hour than we want to see, or you start passing these large blood clots. um,
Mm.
and that still counts as a hemorrhage if collectively it starts adding up. Basically, so that's an important reason why we make sure that mom stays in the hospital at least 24 hours, just to make
Hmm.
sure that her bleeding's under control. um, Depending on if mom had blood pressure issues, sometimes we have something called rebound hypertension, where uh, we may be delivering them because they had higher pregnancy induced hypertension. And so we are saying, hey, let's have a baby,
Hmm.
to try to reduce that.
Hmm.
And their blood pressures may normalize. And then a month later, they come back and they're crazy. They're like 170s over 100s. And so anything can happen. In the actual labor, the sky's the limit. There's so many. It's a variable and it's very fluid. And you can you can have a wonderful moment, and then a second later something crazy happens.
Wow.
Sometimes we have explanations for it, and sometimes we don't.
Okay.
So so to give you a short answer, bleeding is always a concern. So we are definitely monitoring bleeding. We're definitely monitoring your baby, to making sure that they are tolerating the labor process, because babies will let us know real quick. So people are sitting there watching the monitors, and they're looking at contractions and all this, and we're looking at that baby, and we're looking at how that baby's tolerating the contractions, or not.
Mm.
And we're looking at, just, the baby tells us whether they having a birthday through the vagina or if they having a birthday through the abdomen. So, oh my God, the baby will let us know real quick. Yeah, them contractions, we don't like that. Or I'm doing just fine. Let them, throw them at me. So
Oh.
monitoring that monitor strip is telling your nurse and your doctor or your midwife, a lot about what's going on in that process. I know I
Mhm.
kind of went off on a tangent, but the short answer is a lot can happen.
I mean, I know I'm encompassing just a few things in a
Mhm.
short time, and this is probably something we could have a whole separate episode. I mean, not episode, so a whole separate podcast on.
Series, right? I'm gonna say we have
Yeah.
series at this point.
Yeah, a
Yes.
whole series on, just because I mean, my son will be 21 this year, and
Mhm.
I was very fortunate to have a very healthy pregnancy, a healthy delivery. I mean,
Mhm.
I was in labor every bit of 30 minutes. And I don't
Mhm.
like telling, especially new moms, my story, because it's not a
Mhm.
common story. Because even
That is very atypical.
my mom was like, I've had 5 kids and I didn't go, this was quick, and
Yes.
we real we realized, as I talked after I had him and I talked about it, like my back was hurting that whole week. And I was probably in labor, having
Mhm.
early labor symptoms and stuff, but it
Mhm.
just was lower back pains. I was just uncomfortable. I wasn't like,
Right.
felt
And
like I
at
was
that point, you're always uncomfortable. At that point of pregnancy, it's like, okay, my back hurts. Like,
right. So I do. Anytime encounter any moms who, especially if it's their first baby, I'm like,
Mhm.
I don't want to tell you my story because every pregnancy is different. And I always actually tell them, don't listen to other people's stories because they will frighten you. And your
Mhm.
journey is your journey. So
Exactly.
yeah. So I
I
was
usually get. No, I'm sorry. Go ahead.
no. Go ahead.
I was going to say, as a first time mom, because each baby you have, the labor tends to go differently and go
Hmm.
faster. But as a first time mom, I usually give them the baseline of 12 to 36 hours, depending. it,
Yes.
it
Yeah,
can
I
it
don't
can
know nothing
vary.
about that.
Yeah, you sure don't. That's atypical. Whether that's your first baby, second baby, 15th baby, that's a fast labor.
Yeah, my mom did. I won't ever forget the day. I remember going into labor, and she was freaking out because my water broke at home, and
Hmm.
everybody's like, "Why are you freaking out? You've had 5 kids. Like, why are you freaking out?" She was like, "I
Right,
don't understand. The baby is on the way. All of my
right,
water broke at the hospital. We need to get her to."
right. She's like, we gotta go out. We gotta get out of here.
And
Like,
I did. When we got to the hospital, I had already dilated 4 centimeters. I mean,
oh,
Tommy
he was
came
ready.
fast.
He was ready. He's like, hey
Yeah.
y'all.
Thank you,
That
Chanél.
is funny.
So my next question is
Mhm.
that I am noticing more moms getting back to breastfeeding, which I think is a
Mhm.
beautiful experience. Will
Mhm.
you explain the value of breastfeeding?
Breastfeeding is liquid gold, ladies. It's liquid gold and it's free.
Yeah.
So, so let's start from there. But your breast milk, especially that colostrum, which is basically that pre-breast milk that is there prior to your breast milk actually coming in. Breast milk
Hmm.
usually comes in as breast milk as we know it. Usually
Hmm.
comes in about 2 to 5 days after delivery. Every woman's a little different. Um, that those first couple of days, pure gold. It's
Hmm.
colostrum. It contains all the antibodies and all the good nutrients that your body has been building up for that baby over that 9 to 10 month period of gestation. um, Great antibodies. It helps them fight viruses, bacteria. A lot of babies are tend to be less sick with those type things, and especially if you're sending your baby to a daycare. The first year of daycare, they sick with something, ear infections. But the breastfed babies tend to not be as sick.
Hmm.
um, and your breast milk will change according to your baby's needs.
Hmm.
So if your baby is starting to get sick, like if you can start to see the color differences and it becomes enriched with different antibodies and different things that your baby is telling your body that it needs. It definitely is a supply and demand situation. So a lot of times in the beginning, some moms get discouraged because they'll feed the baby or they'll try to pump and they'll get little droplets and they're like, well, I'm not making enough. It's a
Hmm.
supply and demand thing. You need to start breastfeeding or start pumping or offering your breast to the baby every 2 to 3 hours to tell your body like, hey, we need to be making this. This baby needs this. So um, breast milk is definitely, you know, top notch premium filet mignon type stuff. However, I
Yeah.
say that with a caveat: feed your baby the way you need to feed your baby. Some people get
Yes.
lost in the fact of I'm not breastfeeding, and they go down this rabbit hole of things that can lead to depression and all this stuff because they're not
Hmm.
feeding their baby in a way that they thought that they could, or they feel like their body has failed them. And so I also say your a best baby is a fed baby. And so
Yes.
however that comes for you,
Absolutely.
whether
Absolutely.
it's through Gerber or booby, like listen, feed your
Similac.
baby. And yes, Similac, Enfamil, store brand Target. Listen, because formula is expensive. But breast is always best, but feed your baby.
Yeah. Thank you for bringing it up.
Yeah.
Just thought about that. Like, there is still a great thing, of course, with, you know, 'cause I know there's a huge battle with breastfed babies versus bottle fed
Yes.
babies. And a lot of breastfed babies still are bottle fed because they have, you know, moms have to pump and put the milk in the
Hmm.
bottle. And again, this could be a whole series in
A whole
itself.
slew of stuff. Yes.
But these are just a few questions that came to my mind that I wanted to cover, and you know, maybe somewhere down the line we could come up with you know that idea, or actually put together something like this for moms to listen to. That's actually a good idea. I'm write that down.
Write that
Write that
down.
down for you. Okay, so another thing that we all know with most pregnancies is that postpartum
Hmm.
depression. Will you
Yes,
please
yes, yes.
explain postpartum and how many women are affected by it? Not like the exact numbers, but just a
More,
general
yeah,
consensus.
more women than you think are affected by postpartum depression. And
Mm,
some women already have a history of depression or anxiety or PTSD of some kind. So they kind of can recognize their symptoms. And some women it hits them out of the blue and they don't know what's going on. Um, I don't have a number to really quantify
uh-huh.
what it is, but that first week of pregnancy or first week of postpartum, your
Uh-huh.
body is going through it's getting run down by all types of hormones. So you could be laughing 1 minute, crying 1 minute. Your body is trying to normalize itself back because you really literally hit this climax of hormones, delivered this baby, and your body's like, now what? so um so you trying to normalize and get back to your new normal, it
Mhm.
takes your body through it, and it takes chemically it takes your mind through it. You're fat, at least you feel fat. You're not fitting into your clothes, you're exhausted. Like at the end of the day, you got this baby that's crying,
Yeah.
you haven't showered in 6 days because I'd rather sleep than even eat or shower because this baby has had me up forever. But it is something that you need to monitor, because if you get to the point where you feel like you want to harm yourself, harm your children,
Mm.
harm or a lot of times it's the support person that's coming in and saying, yeah, she ain't right, or something. It's more than just a little sadness, or it's more than um just she's tired.
Mhm.
um so you do, if there's somebody that's close to you that can kind of point that out and you be receptive to it, like, yeah, something's not right. It's past being postpartum blues or postpartum depression. After 6 months, if you're still having an issue, is definitely something that you need to be seeking professional advice for.
Mm.
And that's why when the doctors, or when you come back for your follow-up appointments,
Uh-huh.
even some of the pediatricians now, because we live at the doctors after you have a baby, you're at the
Right.
doctors when they're first week, second week, first month, third month. I mean, you're always there. So now some of the pediatricians are starting to incorporate postpartum depression screenings into their care for the mom.
Oh, that's
um, yeah, so I mean, not all of them do it, but I've heard
mhm.
a decent amount that are starting to do it. But
Mhm.
your provider will do a screening. It's called the Edinburgh postnatal depression screen,
Mhm. Mhm.
and it's a series of questions that they ask, and it gives them a score, and based off that score it tells them if this patient is likely to be experiencing postpartum depression or not. Sometimes some women have had postpartum depression before, and they already start them on an SSRI, which is a depression medication, anxiety
Mm.
medication, at the before they leave the hospital. Depending on if mom already had pre-existing issues with depression, some women even take antidepressants throughout their pregnancy. So that's definitely a thing that you need to go to the doctor for, to make sure that you're taking the right one, because some of them are just a no-no in pregnancy. So you need to be
Uh-huh.
taking the right medication, and that just make sure that's being managed very well, because it can be very serious. It can be life-threatening for some women, and that's definitely something that needs to be monitored.
Wow. In the midst of you saying all of that, I just thought about this the term snapback, that
Mhm.
snapback culture that people have now. Like after you have, for
Mhm.
those of you that don't know what that is after you have a baby, like within a week or two, your body just
Right.
takes
You
back
in
to the way it
a
was.
bathing suit, like,
Yes, and this
and not the
is
mom suit.
yes, that is so unhealthy. That is so
It is.
unhealthy. Oh my gosh, that is so
And it messes women's psyche, because like you said, they see on, IG or Facebook or whatever platform, Twitter, whatever you're looking at, they see these women who had a baby 5 minutes ago, and they already in bikinis, or they already, a lot of that stuff, ladies, is smoke and mirrors. It's
mm-hmm,
not real. They have
mm-hmm,
surgical intervention. They got
mm-hmm.
money that you may or may not have. So, I love seeing when celebrities post their real mom bods, and they in the mesh underwear, the mesh
Yes.
Victoria's Secrets. They got a pad that's bigger than them that's on. And because that's the real deal. Like,
Yeah.
don't think that you are going to fit back in your jeans. And some women do. And,
Yeah.
I
Yeah.
hate them, but it's okay. But it's not everybody's story, and it's not most women's story. They are
Yeah.
actually the atypical ones. So
Yeah.
they're the black unicorn, like Angel is with this 5-minute delivery. So
So I'm sorry, like the more the more I've been going over this stuff, I'm like, this literally can be an entire podcast by
it
itself,
is.
talking
It
about
is.
the journey of a pregnancy, because it's not, some people glorify it. And like I know somebody who passed away after giving birth, and I thought when I got
It's a
that call,
real.
it was unreal. I'm like, are you freaking kidding me? And they're like, why would I joke about that? And I'm like, I had
I mean,
never
because
heard of that.
you don't, and what people don't realize is they usually think that labor and delivery is the Disneyland of the hospital, and it's usually a happier place than most places. But
Right.
people don't think about the fact that babies die, mommies die, everybody's not born alive. It can be.
Mm,
I always tell
yes.
people, it's wonderful, but on its worst days, it's the worst days,
Mm,
because it's, there's some days that we're counselors, because, you're talking a woman through labor knowing that she already has a dead baby inside of her. Like,
mm,
just how do you reconcile with that? And, sometimes we go home and we look, so I've cried with patients before that, they lost their babies, because from woman to woman, like, there's nothing I can say to make that better. And
absolutely.
so some days it's just you crying with them, and
Mm,
you have to feel the room out and know what that patient needs at that time. But what do you say to that woman? Sometimes there's nothing to say other than, I'm gonna hug you and we gonna cry together. Move over in that bed, because
wow.
anything can happen, and death, including death, of one or both of your patients. So
Yeah.
it's definitely, it can be a rough day.
Yeah. Oh, I know. I know you have some of those rough days. I do I'm not joking. The more I'm asking these questions, the more questions are coming up. And I don't want,
Mhm.
just for clarity's sake, anybody listening to this, anybody watching this, I'm not trying to rush this conversation into this tiny window. These were just some initial questions I thought of. And I have so many more questions. Like I said, my son will be 21 this year, but people have babies every day, and there's so many questions. And that would be a really good idea to start a
Yeah.
podcast about that, or a whole series just talking about the pregnancy journey, on
Mhm.
so many levels. So I just want to put that disclaimer out there. I don't want anybody to be offended by anything and think I'm trying to make light of pregnancy. Most people have, a healthy pregnancy, but it's a lot of people still who they don't get to experience that. Then you have,
Mhm.
the, I don't want to call it drama, but the feud between moms who have a C-section versus a
Oh, that's a
vaginal,
whole
a
nother,
vaginal.
right?
didn't know that was a thing until
Oh, it's a
recently.
thing. And some
It's
people feel like
huge.
you didn't give birth. I've had two C-sections. My body just totally misses the labor cues, and I wanted desperately to have a vaginal delivery. But best believe, I always tell people, you know, when you have a baby, whether it be vaginal or via surgery, C-section, it's
Mhm.
whether you get the pain on the front end or the back end, but the pain gonna come. So you had a baby either way. Let me tell you. So to shame a woman because they didn't have a baby through their vagina is crazy, and to shame a woman because there's some people I know that nurses included. I had a coworker. She was like, "Sign me up for my C-section." No indication for it. She just did not. She was like, "My vagina is going to be staying right intact." She was so serious. I don't know. She willed herself a C-section too because it didn't work out. She tried to start laboring and it didn't work out. But at the end of the day, you get the same prize. That's what I tell
Absolutely.
them.
Yeah, when I heard about that, I think it's been in the past couple of years. I didn't know that was a thing, and that's just so rude for
It
anybody to
is.
tell a woman who's had a C-section that basically she's not a real mom, or she didn't really give birth because she didn't push
Mm-mm.
this baby out vaginally. The same risks exist. In
Now
my
it's
in my
worse.
mind, it's even worse because you have to trust these doctors to cut you open and get your baby. We've heard the stories of babies being cut, having,
Little nicks and yep,
yeah. Oh,
yep.
Chanél, I want
And
you
let
to
me tell
do
you, and you get a fupa, which ain't cute.
you to start a podcast about pregnancies. The more questions I
All
keep
right, I look okay.
Chanel's like, I'm busy and oh my gosh, that would be
No,
such a good idea. I know you got a
I think
lot
it's
on
a
your
good
plate.
idea.
Like, yeah, we've been crazy busy, all of us, but ooh,
That's all right. We're gonna make something happen.
I'm here for it.
We're gonna
And
make something
of course,
happen.
I'm not trying to have any more kids, but I like to be informed and give people informed information. You know what I mean?
And yes, and that's a big thing that I am very adamant about specifically women, but
Mm-hmm.
women having being autonomous of their care and having a say so in their care. Don't just do something because a provider told you to do it. Ask questions. There's nothing wrong with asking questions because you need to be informed about your care and you need to know what's going on with your body and you need to be a decision maker in your care. Don't let people tell you what they're going to do without your input.
Right.
So that's very important for me.
I love you. Thank you.
No problem.
Okay.
I love you too.
So my last question, will you please tell us about CMT Enterprises LLC and the services that you provide?
So CMT Enterprises is my company. I started out because I became a legal nurse consultant and I started doing some expert witnessing, specializing. Yes, honey, I'm specializing, and that look the opportunity literally fell into my lap. But specializing in labor and delivery cases. So I've gone to trial. I've also just reviewed paperwork to see, given my expert opinion on things. I am starting to branch out into just medical consulting in general. I've done speaking engagements, so it's kind of like it's becoming my umbrella of services of
Yes.
Chanel. But initially it started out as legal nursing, expert witnessing type things. But so that's what I do on the side. So I'm very excited about it. I've done some work with it. And
Mhm.
look, the first day I was in there, I was like, yo, this is really like law and order in here. Like, like we on trial. But I'm very excited and to see where this goes and see where
Yeah.
as my business expands. Um, I've been doing some freelance stuff, like I said, speaking engagements for different professional organizations I've
Mhm.
done. So I'm just excited to see where it goes. It's kind of evolving and creating its own lane, truthfully. And I'm just
Yeah.
showing up for the ride. But if you do need some legal work, legal nurse consulting work, I'm your girl. Hit me up. I specialize in labor and delivery. If you want to get in contact with me, my email is rnconsultant63@gmail.com. Again, that's rnconsultant63@gmail.com. But check me out.
Yes. you so much, Chanel. Like I said,
Thank you.
we could talk. This could be a serious. This is actually, I mean, of course, it's not my field, so I can't really. I would be asking people a ton of questions. This
Nope, you
is
know
a
what?
Yeah, this is a really, really good idea.
Yep.
So that people
I see them eyes moving. She thinking, y'all.
every time I'm talking to somebody, my mind just starts going, and I'm like, I am so sorry.
I love it.
Thank you so much for your service. Thank you so much for the knowledge in that brain of yours. I know you have over, what is it, 14 years of experience. I was going to say over a decade, but I wanted to be specific.
That's
14
good.
years of
It's all good.
experience in your field, and that's a beautiful thing. And I really hope that you're able to continue to provide people, especially women, of the knowledge that they need when it comes to bringing life into this world. So thank
Definitely.
you so
Thank
much.
you. I want to thank you for starting the conversation because some women don't even know what they don't even know. So,
Mm,
as you said, we can start going down rabbit holes of various topics in pregnancy and in women's
hmm
health. But just for you to even initiate that conversation, to initiate that spark, um, I'm thanking you for that because,
Oh, thank you.
women need a platform, and
Yes.
here we are.
Yes. Maybe this is the beginning to a much
Yes.
larger platform. I'm here for it.
Yes.
Thank you so much.
Yes.
No, you have a wonderful day. Thank you again for allowing me to pick your brain on these few little subjects of a pregnancy.
No, thank you for allowing me to speak my little 2 cents.
You have a wonderful day. Thank you.
You too. Thank you so much.
You're welcome. I'm so grateful that I got a chance to sit and chat with Chanel, and talking about a healthy pregnancy journey. Um, but I just want to close out this episode by saying that you are loved, you are supported, you are enough, and you are worthy. Thanks for tuning in. Thanks for joining us on Under the Umbrella podcast. Check us out on Instagram at UT Umbrella, on Facebook at 1UT Umbrella. Subscribe to our YouTube channel at Under the Umbrella, and visit our website at utumbrella.com. As always, subscribe to the show to catch every new episode, and leave a review so we can continue to bring you fresh content. If you had a question to submit for the Ask Angel segment, please submit to contact@utumbrella.com. See you next week.